Welcome back, everyone, to Vox Markets. My name is Paul Hillel. I'm delighted again to be able to speak to CEO Sara Barrington of Verici DX, a next-generation medical diagnostics firm for serving the global kidney transplant market. So, big welcome, Sara.
Great to be back, Paul.
Yeah, well, many congrats on today's positive full year trading update with the company's flagship blood test, Tutivia, seeing sales increase to $3 million from zero on the prior year. So maybe we can start there. I don't suppose you could just quickly take us through what's been driving that impressive top line growth and also give us a bit of color on the sort of the status and progress of the commercialization strategy.
Great, thank you. Well, yeah, yes, last year was a year of growth, but it was also a year of challenges, if you remember. So, we had internally, we called it the year of waiting when we were waiting for the Medicare coverage to come through, and that came through in April, which was delightful. That obviously is significant to a company like Verici because about 70% of our patients are covered by Medicare. Vital to revenue recognition there. And then, obviously, we had other milestones that we were achieving last year, but, became with challenges. So we had a bit of a late start to the year, later than we would have wanted, but we decided to still keep and go for that revenue target that we put out there. Getting to the 3 million, I think, was an achievement. Part of that last year was that we got funded so that we could expand our sales team. And in fact, we have done that. And the latter part of the year saw us onboarding some top-notch people. So we're delighted with the quality of our team and the impact that they're having. For us, that means that, we've had a strategy of sort of exploring those centers that were already open in our early access program to make them sort of full-blown commercial centers for us, and also opening new territories. Now, I will caution everybody, we didn't hire enough people to have national coverage. We're about a third of the country, but nevertheless, good to see it. We also started to have, as we explained, a strategy of, for any of us that are Londoners and listen to the tube messages of mind the gap, it's fill the gaps, recognizing that obviously a good entry point to the market is finding those areas that are completely underserved, but already primed for need, primed for testing. So obviously with our competitors in the field, having primed the market for biomarker testing, we're able to find areas where we can be adopted by centers at minimal barriers, because we are operating where they cannot, or clinicians feel that they do not. So we've done that. We've gone in and we've built an entry point where we can obviously lean into that need that is underserved, and that's been quite successful for us, as you saw from the release today.
Yeah. And then just on that pace of sort of adoption and sort of coverage, I mean, I did see at the end of June last year, you had 21 transplant centers, which was represented about, I think it was 10% of the overall US patient, kidney transplant patient population. And that accelerated to, I think it was 34, you said, and then 18%. So you've almost doubled, certainly on the patient coverage over just in 6 months. How would you see that sort of like that inflection going forward? Because that's a pretty good delta.
Well, thank you for that. The sales team will be delighted to hear that. Yes, well, we doubled our numbers in salespeople, and then they hit the ground running. Obviously it takes a bit of time to leverage a site. You may only start off with kind of onesie twosies. And in fact, we've just started to really indicate where we have ordering centers. I think that this is something that we are very passionate about in Verici. The team are very committed to that sort of idea of accelerated growth. And I'd like to see that, mimicked in this year's numbers.
Yeah. And then just in terms of that sort of like the sort of the pace of volume coming through. I mean, you've now got obviously Medicare coverage, which is presumably the vast majority of kidney transplant. How given you've now got sort of like you say about 18%. What sort of like if you've only got to start off with one and two sort of like physicians, how do you see that developing? Because presumably these guys speak to each other, and then they start endorsing it, and they start saying this test really works, and recommend it to their fellow
Yeah.
colleagues.
Yeah, they do. They go out and do things they call grand rounds, and obviously, for anybody that's interested in the more clinical side, you'll see our coffee and cases on our website. It's these are clinicians able to go out and talk to one another about what it's like in real life. There's always that question in healthcare. Okay, you did a fancy trial, but how does it work in reality? And our real world evidence actually indicates that it performs better than the trial. We were very purist in our trial. I think that serves us very well in the long term. But we sort of threw the kitchen sink at it, knowing that quite often that's your commercial, your clinical reality. So we were really hoping to partner with the clinician and go out with something that would perform well, and it's performed better in real world. And that's the sort of thing the message we need to get out, that it can be something that is trusted to perform. And in fact, we do have our champions that are out there banging the drum for us, which is always heartwarming for me, actually.
Yeah, that's good. And then just outside of sort of Medicare in the private payer sort of area, could you just take us through the progress there? Because I did see you didn't to deal before, I think it was before Christmas, with Prime Health Services, and then this morning was the big news with Blue Cross and Blue Shield of Illinois. Can you just talk through the significance of that and how investors should sort of like
I feel like we're
understand
going to
it?
be doing an educational piece on the US healthcare system. So be warned. The US from the private insurance field has something called a PPO, and that enables you to bypass your GP, as it were, and go straight to your specialist. Obviously, that's an important area for us in the transplant area. Clearly, that's quite highly specialized area. If you are in a PPO network and you have a contracted price, then you are what we call in network. And I can tell you, even I, when in my own health insurance, always am looking for providers and tests that are in network. Why? Because what happens is that my share of the total bill is less. For example, it could be 10, 15, or 20% of in network, or anything as high as 40, 50, 60% of out of network, a significant difference. So, from the patient's perspective, they like these kind of deals that, on tests, because it gives them certainty and a reduction in their final bill. Clinicians like it because patients are happier and they're not phoning up their center to complain about their bills. And insurance companies like it because it gives them certainty. They've pre-vetted it, and they know what their costs are like. To gives a little bit more certainty there to their cost structure. So it's a kind of win-win-win-win-win. So I like those. But it is fragmented. Luckily, in transplant, there's really only 5 major private insurers for that, about 30% of our patients. And Blue Shield, Blue Cross is one of our major ones, particularly in the Illinois. The nice thing is that they are also closely aligned with another big district for us, which is the Texas area. So, to be able to get this sort of stability, the price set, the in-network statement and status, and then obviously, that helps us all in the reimbursement and the speed of getting claims paid. So thank you for the opportunity to give a tutorial on private healthcare in the US. But yeah, that's the significance of these kind of announcements. And I did warn everybody that I don't, we will just continue to issue them and say it's a good thing.
Yeah.
We're doing our jobs. We're working our way through this on a national basis. But yes, it's highly fragmented world over here, and yeah, you just have to, go where your claims are and steadily work through it.
Yeah. And so that one with the Blue Cross with Illinois, then it presumably because you got the Blueprint contract, it makes it much easier to get the other states within the Blue Cross sort of like federation. So in terms of, I think he mentioned it had got 118 million members for that particular network.
Yeah, I'd have to look up the precise numbers on that, but yes, it's large.
Yeah.
Not quite the largest. I think that's United these days, but a significant player. Yeah, I mean, you've seen the political environment here, so you know how this should, one state should look, be influenced by another goes around here. But yeah, there are certainly, coalitions of influence within that, and for us, it covers most of our territories. So I think that'll be a good thing. We won't announce every contract that we do. That would just be silly, but every now and again we try and pick something up, and just to reassure everybody that we're making progress, we're doing our jobs, we're getting on with it.
Yeah, okay. And then just on those the insurers, there was some big news about 2 weeks ago, I think, that the Medicare had put out some new pricing for the health insurers for 2027, and a lot of them actually, unfortunately, saw their share prices it was impacted. Is that anything to consider at all for Verici?
This was aimed at the private payers. So, on one level, it may have a knock on downstream effect to us all. But, if you peel apart what's actually happening, where they're really trying to tackle this issue, in many cases, they get a sort of risk-based monthly amount for patients. And that calculation has been, more and more, I would say, sort of they've mined the patient records for more and more sort of diagnostic codes to be able to sort of bump up that and maximize that monthly amount, fairly or unfairly. That's not for me to say. But Trump decided it was unfairly and it needed to, some modification. So what they're doing is they're trying to tie it to specific patient visits, which is what we do anyway. So,
Yeah.
on one level, I was like, fine, that's not really going to change anything specifically for Verici. Obviously, it's an ongoing battle. You never quite know what comes out of it. The healthcare companies could, if they think their margins are being, tackled or compressed. And don't forget, their margins aren't huge. It's always surprising to me that, if you look at the bottom line, it's not the most profitable business in the world, right? So if they feel that their margins are being compressed, they could, really sort of elongate reimbursement, look for more authorizations, but they're pretty maxed out on that, I think, before they get a big backlash. They're already getting a backlash. There's quite a lot of lobbying, and I think they'll have to tread very carefully how they respond. Probably their best bet, given the volatility of announcements that come out from this administration, is to go lobby
Mm.
and see if they can get that softened. I mean, it was only the first shot, and as we saw with tariffs, there is quite often, a walk back on that. So I don't see anything in the short term. I think it'd be a process. I can understand the market's reaction because effectively it's a declaration of war on the healthcare system. But I think once they taken taken the proposal apart, it's not unreasonable to start there, and we'll just see how it sort of gets negotiated out.
Yeah, and also just the big picture wise, two tibia reduces healthcare costs, doesn't it? It improves patient outcomes and actually reduces costs. So if Trump
Yeah.
really wants to cut healthcare costs, then he should be taking it all every single time. Two tibia.
Yeah, well, I'd like that. Perhaps you can come to Washington with me, Paul, and we'll make that case together.
Yeah, I'll definitely love that trip. Okay, we're just coming to the end then. I mean, obviously the business has done, accelerating momentum heading into 2026. Any sort of final comments about sort of like what investors sort of expect? I did see obviously your cash runway is towards the back end of this year, etc. But just big picture, how you see this year, this next 12 months panning out.
Yeah, we go into the second half of this year on the cash runway. And I think that's to expectations. The year-end cash was slightly higher than forecast, which was shout out to David and his power of saying no. But this year we're really looking to ramp up that growth. I think everybody's wanted us to hit the first year, get a little credibility under our belts. I think we've done that. It was a tough year, but we still stuck with it. Shout out to the team on really pulling it out in that last quarter. And I think, realistically, what we've really been doing is putting in the foundations for growth for this year. I'm very excited about this year. It feels like this is our year. Goodness only knows what will be, what hurdles will come our way, but nevertheless, we're looking to really sort of show that growth, show that kind of confidence that we've got a place in the market, and this year is one of our years.
Brilliant. Okay, well, very much looking forward in hearing the good news coming down the pipe. So thanks a lot, Sarah, and speak to you in a couple of months' time.
Yeah, look forward to it.